how it's spread and what you know about it at this time. I mean, essentially our understanding is that it's originating in China, but there have been cases discovered elsewhere in Asia.
Sure, so maybe I can give you just a little bit of background information on coronaviruses to begin with. So these are a broad family of viruses that are actually named after their microscopic appearance. A corona looks like a crown. And there are, again, dozens of these. There's a few of them that are known to infect humans that largely cause relatively mild upper respiratory disease or common cold. And then more recently, we've had outbreaks of coronaviruses that can cause severe lower respiratory tract disease or pneumonia. So the first of these that we became acquainted with, you might remember, your viewers might remember SARS, that also came out of China back in 2003. More recently, we've had MERS, which is known as the Mideast Respiratory Syndrome virus, which is coming out of the Arabian Peninsula. So now this is the third kind of novel coronavirus that we're having experience with that can cause severe lower respiratory tract disease. These typically spread from person to person via large droplets, respiratory droplets. So when somebody coughs or sneezes, it can be transmissible that way.
There were reports that this started at a food market. It is not a foodborne illness, though. This is something that's spread just via the air.
Correct. So many of these coronaviruses have a natural reservoir in animals. And so we know that in certain instances they've been able to infect camels or cats or bats. And the original descriptions of this new coronavirus coming out of China appear to be linked to a food market where they had live animals that they would sell. So the hypothesis is that there may be an animal reservoir that has now transferred into humans.
So there has been at least one case here in the U.S., someone that had traveled to that area of China. What is your message to people here? I mean, how concerned do people need to be about this virus?
So maybe I'll turn to Dr. Lawler, who's our expert on global health security, and he might be appropriate to answer that question.
So I think right now the risk in the United States and in most countries outside of China is very low. The outbreak really seems to be concentrated in the city of Wuhan, which is in kind of central eastern China. And in the US, we should probably be much more worried about influenza and respiratory diseases that we know cause significant morbidity and mortality every year. So on an average year, 30,000 Americans die of influenza. So we've had one detected case of this new coronavirus in the US. So I think it's appropriate for folks to temper their alarm. But it is, I think, reason to be aware that we are vulnerable to emerging infections anywhere in the world. With modern transportation, you can be anywhere in the globe in 24 hours. And so, I think the good thing is it highlights that we've become much better at detecting, these types of events. Our surveillance is much better than it was even in 2003 with SARS. And I think the fact that just a couple of weeks into the outbreak, we have a much better idea of what the pathogen is. We have systems already in place that are doing surveillance and detection and tracking, and so I think we're well ahead of where we have been with previous outbreaks. But again, this is unfortunately something that's going to continue to happen. New and emerging diseases are not going to stop anytime soon.
Can you talk a little bit about would Nebraska Medicine have any role, the biocontainment unit, in responding to this, particularly if it continues to grow?
Angela, why don't you take that as our director of the biocontainment unit?
Sure. So yes, we definitely in the Nebraska Biocontainment Unit follow this and any other outbreak going on in the world very closely. And I do feel like that in our role as a biocontainment unit and also as one of the leaders in the United States in biocontainment, that we should not only be monitoring this closely but also serving as an example for others as far as doing appropriate travel screening here at Nebraska Medicine, making sure that when people come to our emergency department or our clinics that we're asking that question, have you traveled somewhere outside the United States? Not necessarily just for this virus that we're discussing, but for other pathogens as well. There are other outbreaks going on in the world as well. But yes, in the biocontainment unit, I do feel like that we should serve in that leadership role and to provide that guidance for others in their infection control management of these type of pathogens.
You talked a little bit about the change in response to these kinds of illnesses as compared to SARS 15 years ago, I suppose. Can you expand on that a little bit and talk about what the global response looks like in terms of containing this type of outbreak and treating it if that's something that's occurring?
Sure. I think overall this response has been much quicker and much more open and transparent than what happened in 2003 with SARS. So SARS was going on, and there were cases that were popping up in hospitals, and transmission was occurring for months before anybody really became aware of it outside of the local endemic region. And then it took quite a while to identify what the virus was and to implement appropriate travel screening and precautions. And by that time, the virus had escaped and was in Hong Kong, was in Singapore, was in Vietnam, ended up in Canada. And so you really had a worldwide outbreak at that point. Hopefully, so far, we seem to have done a much better job of identifying cases and implementing the appropriate public health measures to prevent spread. As I mentioned, the Chinese government has actually been very transparent and open about sharing the status of the outbreak, and identified and notified partners in the World Health Organization very quickly. The WHO is apparently meeting to discuss whether this should be declared a public health emergency of international consequence. I think at this point, most experts predict that will not happen, that the WHO will be satisfied with the status of response right now, and the fact that this appears to be, so far, relatively confined, except for a few cases that have kind of gotten out on airplanes. And so I think overall it does demonstrate that the world has made significant progress in combating these types of emerging disease threats.
And if I could elaborate just a little bit on that, clearly here in the United States we're being very proactive. So travelers from Wuhan, China are actually being funneled into 5 airports in the U.S. now, where they are being screened for any kind of respiratory or febrile illness. If they were discovered, they would be observed carefully and quarantined. Similarly, they're being given information that if they arrive here and then become ill, that they should seek a medical attention, and obviously alert medical personnel that they've been potentially exposed in Wuhan. So we're very much ahead of the ball game as opposed to where we were years ago, and are being very proactive with this. Here at Nebraska Medicine, as Dr. Hewlett mentioned, we clearly have already put in travel screening for people coming into our clinics and emergency department. We have the biocontainment unit on alert if we needed them.
One question that we've heard on staff here is people locally have had children or friends or known people who have been diagnosed with coronavirus, and it's confusing to them. They hear the word and they think it's the same thing. Can you explain the differences there? Yeah,
so clearly the coronaviruses are a large family of viruses that cause everything from the common cold, which is what you're referring to more severe lower respiratory tract disease, which is what these newer novel coronaviruses are sometimes associated with. We're particularly concerned with these novel coronaviruses and other coronaviruses sometimes in very immunosuppressed hosts. And so sometimes they can cause more severe disease, even the more common coronaviruses, in our bone marrow transplant patients or somebody who is immunosuppressed, or the very young or the very old. So we do have a wealth of experience with coronaviruses in general, and are learning more about this new one as days go by.
The biocontainment unit is ready. I mean, would someone with a very severe case of this particular strain of the coronavirus potentially come to the biocontainment unit for treatment or quarantine?
There's a chance that could happen. We, as Dr. Brett mentioned, we are travel screening, and if we did have a person who presented to our emergency department or to our clinics that had an appropriate travel history and also appropriate symptoms, then we would consider bringing them into the biocontainment unit, mainly for diagnosis and then appropriate monitoring and supportive care. We do serve as a leader both in our region and the United States. There's a chance that if there were a patient that were infected with this illness in our region as well, that we could care for them in the unit also. And we do stand ready for this and any other pathogen.
question I think I have is, I know that we don't want to be alarmist because the flu is a larger threat for people here in the U.S., but if people have travel plans to go to some of these locations where the disease has been detected, I mean, what are the symptoms or what should people be aware of? Is there any sort of message of what people should be looking out for?
So the CDC has issued a fairly low-level alert for people traveling to that specific part of China that they should be careful, avoid sick people, just some common sense sort of precautions. Again, the coronaviruses generally cause kind of a febrile flu-like illness, and so it could be easily confused with much more common viruses that we're seeing. And as Dr. Lawler mentioned, I think that it's important for viewers to keep this in perspective, that we currently have widely circulating a virus, influenza, that causes anywhere from 25,000 to 50,000 deaths per year in our country every year. And so we need to be, making sure that we're taking appropriate precautions to prevent the spread of those viruses while being on lookout for this novel coronavirus at the same time.
I have a question from a reporter online asking how, if we are currently working with the CDC and WHO and monitoring or preparing for the coronavirus, does the Global Center for Health Security play a role?
Sure. So the Global Center for Health Security is involved in long-standing programs to help train first responders and other healthcare workers in appropriate infection prevention and control. We work very closely with our biocontainment unit colleagues and also with folks here at the university and at the hospital who are part of the Ebola Treatment and Education Center, which is the main resource for training hospitals across the nation in appropriate infection prevention and control. And so, all of those efforts together, really over years, have done a significant amount to increase preparedness in hospitals to manage these types of highly dangerous pathogens. That's another advantage that we have over 2003 is that after Ebola and with the advent of NETEC and other efforts, we've done a much better job of preparing hospitals to manage patients with potentially highly infectious diseases, and that's a real resource that I think could be relied on and will significantly improve our ability to manage an outbreak beyond one or two patients if that's what occurs.
How is something like this different than an Ebola type situation where you have such high levels of travel as compared to not seeing that as much in Western Africa with Ebola?
Well, China is a very common travel destination, both for business travelers as well as for people going on vacation, and so we don't see quite as much travel to those areas affected by Ebola in the Democratic Republic of Congo, namely currently, as we do to China, which is a very common travel destination. So that is one difference about Ebola versus this outbreak is that there are a lot more travelers returning to the U.S. and to other places from China than from the affected area in the Congo.
The other thing I would point out is that the lethality of these diseases differ very markedly, with Ebola being associated with a much higher rate of fatality than the coronavirus infection. Currently, we have a handful of deaths due to coronavirus in China. It appears to be less transmissible and less severe, perhaps, than SARS or even MERS. So we have that to our advantage as well.
Is there a way to compare how transmissible this might be compared to the flu that we're experiencing, and how lethal it might be compared to flu? We've had several deaths in the area via flu already.
Correct, and that's why I think that it's so important for people to keep those things in perspective, that we're dealing with very minimal risk right now from this coronavirus, where we're dealing with a much higher level of risk from very common viruses that we are used to encountering each and every year.